Hi, my name is David Soma, and I'm a sports medicine doctor and pediatrician at the Mayo Clinic in Rochester. And I wanted to talk a little bit on behalf of the Mayo Clinic Children's Center about some common questions I get about concussions. One question I get is, how do I know if my child has suffered a concussion or not? I think that it's a very difficult question, and we do not expect all parents to be doctors and make decisions about whether or not your child has a concussion, but I think it's important to recognize some of the basic signs or symptoms that may be present that maybe would give you the clue that you should have your child evaluated for a concussion. The majority of concussions do not involve loss of consciousness. Probably 90+% of concussions do not have your child get knocked out or, quote, have any sort of loss of consciousness. I think that really the majority of concussions are some sort of blow to the body or head, followed by some symptoms. And the symptoms can range anywhere from headaches to dizziness, difficulty with sleep, difficulty with concentration, or a myriad of types of symptoms. The majority of these are going to occur within a matter of minutes to hours or maybe a day or so within the blow to the head. So typically, if your child is having these symptoms weeks or several days later, then it may be something else. But I think in the setting of a head injury or force to the head with symptoms, that would be maybe a clue to you that you'd want to seek medical attention. I do think it's really important to realize that what we may have called 20 years ago as I got my bell rung, now is actually more likely to be probably some sort of a concussion. I think that if you're having symptoms of problems with your vision, problems with hearing, problems with balance, that's an indication that your brain is not functioning properly and probably a clue that you should be seen by a medical provider.